In the last week, the number of new cases plunged by nearly 70% in India's financial capital, home to 22 million people. After a peak of 11,000 daily cases, the city is now seeing fewer than 2,000 a day. The turnaround represents a glimmer of hope for India, still in the clutches of a devastating coronavirus surge that has raised public anger at the government. A well-enforced lockdown and vigilant authorities have been credited for Mumbai's burgeoning success. With over 24 million confirmed cases and 270,000 deaths, India's caseload is the second highest after the US. But experts believe that the country's steeply rising curve may finally be flattening, even if the plateau is a high one, with an average of 340,000 confirmed daily cases last week. On Monday, infections continued to decline as cases dipped below 300,000 for the first time in weeks. It is still too early to say things are improving, with Mumbai and New Delhi representing only a sliver of the overall situation. And mental health expert Anu Krishna joins me from India via Skype to discuss this. Good to have you join us, Anu Krishna.
Thank you. Thank you for having me here.
We see a drop or a decline in a number of cases or daily cases. Initially, it used to be above 300,000. Now it is below 300,000. Is that reflecting in the number of hospitalizations and death as well?
I wish I could say that. Yes, it is a glimmer of hope, like you mentioned earlier. But I think for the common man, and I count myself as one, the minute we stop hearing ambulances go by every 10 minutes and we don't see or hear the death of a loved one, that's when I guess we are willing to believe that this is under control. Yes, definitely the cases have come down, at least from what the media tells us, that in Mumbai and in Delhi. But if you see in places like Bangalore, which is where I live, I think it is still increasing. It is causing a lot of alarm for us. So we're just keeping our fingers crossed and hoping that this curve will get to flatten really soon. So that's what I could tell you from my personal experiences, what I'm seeing and hearing.
The COVAX program, which is the World Health Organization vaccine program, is now 140 million doses of vaccine shot, and that's basically because of India. So what can you tell us about the vaccination program in India?
Right. So, yes, there has been a shortage of vaccines. I guess that news is out, but there is something that I always like to say. With India, we've always been hopeful and resilient. Yes, for now, possibly that there is a vaccine shortage, but I'm sure the government is finding a way. We do have walk-ins at this point of time for ages 45 and above. So things are looking up, definitely, than what we saw at least about 10 days back. So things are looking up for us, even in the vaccination front.
This week is the World Mental Health Week. And I mean, what mental health couldn't be, we've seen the cases triple just because of the coronavirus pandemic. You and I, the last time we had the conversation, we talked about this and how this has, the number of cases in India has affected mental health. Has there been an improvement since the last time we talked, especially because the cases have now also reduced?
I don't think there is a correlation there because India as a country, we are still very premature when it comes to mental health. Yes, there are a lot of organizations, including mine, which are working overtime since last March, doing not just pro bono cases, but constantly being there for people who need us. But are people really reaching out to people like us? I don't think so, because mental health is still a taboo in a country like India. We would very happily and freely go walk into a hospital and say, I have corona, treat me. But are we going to tell people that I am mentally distressed? I feel low. I think I'm going to be hitting my lowest point. Please help me. I don't think that's happening. So a lot of, mental health organizations, people who are working towards the mental health and who are in the mental health sector have done wonderful work in the past, over a year, in fact, to reach out to people, rolling out free programs, helplines, call helplines. There's so much that's happening. I wish I could say that the mental health is improving, but if I were to just look at my experience of the number of calls that I receive in a day, and even when I support online, channels, I think it is not yet there. I really, really urge, take my message, people, please reach out. I know there is a lot of helplessness at this point of time of losing a loved one, losing your job, and just that air of uncertainty. So please reach out to a mental health expert who can definitely not going to fleece you at this point of time, but will hold space for you. So to answer your question, my dear, not yet there, but I just hope that things are going to change very soon on the mental health front.
And I hope so too, so we do not have another pandemic after this pandemic, which is a mental health pandemic, because everyone seems to be really stressed out. We'll continue to reach out to you for updates on the situation there. Mental health expert Krishna, thanks for talking to us.
Thank you so much. Thank you so much. Yes.